Good afternoon. My name is Corina Herrera Loera. Today's September 15th, and we are here to have a conversation with the community about the vaccines today and any updates that we might have. We have a special guest today, and if you've logged in before, you know him. We have Dr. Gerardo Solorio-Cortes, who will be joining us shortly. And before he joins us, we are going to be giving you an update in regards to the county and where we're currently at. I have several events coming up. We also know that the flu season is here. Believe it or not, we're approaching the fall, and so the flu season is here. So I will be also talking about some of the resources we have for the flu vaccine within our county for folks to be able to get the flu vaccine as well. And so I am, and we might, because we're having technical difficulties, we may bring in the doctor first to maybe give an update in regards to the to the vaccines and testing, and maybe even talk about the flu vaccines. And then I might give you my update. So we might change some things around. Thank you all for joining us. So at this time, I am going to be bringing in Dr. Gerardo Solorio-Cortes. Welcome, Dr. Gerardo Solorio-Cortes.
Hi, good afternoon, Sabrina.
Good afternoon. We're having some technical difficulties, so we're going to change it around this time and bring you in first to give us an update. And maybe, today I mentioned the flu vaccine, and so we know that flu season is here. If you have anything to update us on that as well, and maybe the importance of that, of getting that vaccine as well, and why. So I'm going to go ahead and turn it over to you to see if you have any specific updates on any of those items today for us.
Thank you again. Again, I'm very happy to be here today. Thank you for the invitation. My name again is Dr. Gerardo Solorio-Cortes. I'm a primary care doctor at Valley Health Center in Gilroy. And today I do want to pretty much reiterate what we've been saying for the last few weeks. Number one, if you are above the age of 12 and qualify for the vaccine, please get vaccinated as soon as possible. I'm sure, Karina, you have the data, and we are doing better, and we're very proud of that. The county is too as well. So let's keep on doing the great work. Number two, in the news or just I would say, or just you yourself listening in the community, you might be hearing about the effectiveness of the current vaccines, and I'm talking about Moderna, Pfizer, and Johnson & Johnson. And then you'll hear numbers about waning effectiveness, or antibodies being decreased, or not being as effective as initially thought. I think we could talk about the details and bring about all the studies and have a debate. But what's very real or important is the fact that these vaccines are very effective still in the 80%, 90%, keeping you away from the hospital, and of course saving your life and not dying. So although there is some decrease in terms of the full effectiveness of preventing disease, you'll see studies that look at 50-60% versus the 90% we were talking about back in January and February, talking about just the actual disease. What I could say now is the studies that are being done is that for hospitalizations and death, they still keep up a great percentage, 80s to 90s, and that's very important. A lot of the times, vaccines, if we could get 100%, 90% effectiveness of preventing disease, we'll take that. But if we can't take that, then definitely at preventing severe disease, hospitalizations, meaning that it'll lessen the disease on the individual. Not only that, but it also put less strain on our healthcare system. We will take that as well, and of course death. So we're still at those percentages. That's number two. Number three, for the third dose that's recommended for certain populations right now. We're talking about Moderna and Pfizer. So it's individuals that are going through active cancer treatment, received an organ transplant as well, a stem cell transplant, and also advanced or untreated HIV, or are taking immunosuppressant medications like steroids or other injectables that your doctor would tell you if you're receiving those kind of medications. At this moment, the CDC, FDA do recommend a third vaccines for those individuals, Pfizer's or Moderna, and that will be 28 days after your second dose. Now, for the rest of the population, you've probably seen in the news, and you've heard President Biden, I believe, like one month ago, from the White House recommendations, the task force, they were saying how in terms of the general population, they're thinking about the booster, similar to a third dose, but we still haven't gotten the approval from the CDC and FDA. That's still in the works. I believe in the morning today there was a report published that the task force, if the FDA and the CDC will review it, and then hopefully soon we'll know which general population individuals will qualify for the third booster vaccine. There's debate about, is it 6 months or 8 months after the second dose, Moderna or Pfizer. So there's more to come, and hopefully by the next presentation we'll have an answer. And yeah, lastly, if for anybody, in spite of, I just mentioned a few minutes ago that the vaccines are very effective at preventing hospitalizations and death. That goes to show that some individuals will get infected in spite of being vaccinated. So we still recommend anybody who with any symptoms of COVID to get tested. So see your primary care doctor, or visit the websites from Santa Clara County, and of course continue wearing the masks, especially indoors. Continue the physical isolation, the distance as well. And as you mentioned, Corina, flu shots, we're getting into flu shot season. Some clinics, pharmacies, private pharmacies have them available. The recommendations are to get vaccinated for the flu. So you could get the flu, you qualify for the flu shot and also the COVID vaccine at the same time. So there's no recommendations that say that you cannot take both at the same time. So, get protected both for the flu and also COVID-19. Thank you again, Corina.
Thank you. Thank you for that wonderful update. And just a reminder for those that are with us here today, the doctor's here to answer any questions. I'm also here to support answering any questions directly to him about the updates that he gave or something that maybe wasn't too clear. If you can make sure to put your question there in the comments section, and we'll do our best to answer all the questions that are placed there. And I'm wondering if our technical difficulties, if we figured that out. If we did, feel free to put the presentation on. I think we might be awesome live. Thank you, Gloria. Gloria's behind the scenes supporting us. So I'm going to go ahead and give the update now, and we'll bring back the doctor in a little bit to answer any questions. Thank you, Dr. Gerardo Solorio-Cortes. Okay, so the updates for our county in this community forum. We have here, as we know, or we're doing a lot better, or we're doing better, whether it's one a day, that we add of somebody getting vaccinated, that obviously supports all of us as a whole, not just the individual, but also the entire community. And so as of now, or as of yesterday, we had 87.8% of those that are 12 and older with at least one vaccine dose, and 82.7% of those 12 and older who completed the vaccination process. And 264 new cases, and that's on a 7-day rolling average. Next slide, please. And in regards to our numbers, we are doing better, as we said. And as you can see here on our dashboards, we have these different ethnicities broken down. So you're able to go back in there and highlight any one of those areas. But if you can see with the bar graphs, right, those that are most vaccinated and those that still have a lot to go, you're able to at least see that. But you can go in there and get the exact numbers. In this case, I am highlighting the Hispanic Latino numbers, which good news, we're at the 70% or past that mark now. So we're doing well, but, we're still not there with all of them, with all of us, right? 100%. And so I think there are some of the ethnicities that are at 100%, and, are at that mark, and some even above. So, and what that means is that some people identified possibly as that. So, all that to say that we are doing better, but we're still not 100% of all of our community members here in Santa Clara County. So until we're at that number, then we'll be better taking care of ourselves, our health, and our community. Next slide, please. And then this slide shows the current COVID-19 cases. And so another importance for me was important to highlight this one because it shows the importance of getting the vaccine and what it can do, right? So this number shows those numbers in the orange are those cases with the COVID-19, mainly for the most part, the Delta variant, that have not been vaccinated. And so it's 50.8% of those with COVID are not vaccinated, while 8.9% of those that have COVID are ones that are vaccinated. So we see the numbers there and the difference when you have the vaccine and when you don't. And so for me, that was an important slide to highlight. And know that these are all available on our dashboard, so you can go back in there and check in on our numbers periodically. But these are the numbers that we have for today's presentation. Next slide, please. And then we know that our schools are open, our children are back in school. We had our last community forum on schools, and we had a lot of questions around just kids in school and their safety. And so just a reminder that if your child has any one of these symptoms, don't send them to school or daycare. And, obviously all the symptoms that are under COVID, if it, sounds like, feels like flu, right now we don't know, unfortunately, if it is a flu or COVID. So the next best thing is then to get them tested. Next slide, please. So here is our resource to get tested. My understanding is that most schools are now finally getting testing at their schools. There was a little bit of a holdup in the beginning because the state had so many sites to be out at. But now my understanding is that most schools have testing. However, understand that if you're not sending your kid to school, then we get it. They're at home and you need to find another place to test them. So here is a resource. The www.sccfreetest.org, and you can go there, and there are different sites throughout the county. Look for one that best meets your time, and that is in your area. Go there, or you can call 211 at any time and also get the support in that way. But definitely get tested so that we, obviously, and then when you take them to their medical providers, you can inform them of what they have, so that they can or you as a parent can better take care of them, and we also stop the spread of COVID. Next slide, please. And then this is just a reminder of face mask wearing. Just a reminder to, as parents, I know that we're doing good, but our little ones, they might need a refresher for us to sit down with them and practice and ensure that they're wearing their face mask correctly. And so just making sure that the mask goes over the nose and then under the chin, and then making sure that it fits nice and snugly, nice and where it covers around and it's not loose. And, making sure that if we need to tighten it, that we make sure that we tighten it, or that we might get them smaller ones. And the schools also have different, size masks for the children and adults. So if you need any support around that you can get the appropriate masks for them. And then obviously all of the don'ts on there, are there. And just mainly our focus here, and what I wanted to focus on, is to refresh and sit down and go over these things with our children. Because sometimes, in playing, remind them to maybe take a pause and check in on their mask again. And also it's important to take breaks and, because I know that when you're doing a lot of activity and you have the mask, it might be hard to breathe. So it's okay to take a break, check in, drink some water, and then, make sure that when you put your mask back on, that it's nice and tightly fit around your mouth and nose. Next slide, please. And then these are some events that we are having as a county, city, different agencies coming together to ensure that we're able to provide the vaccine at different times. And so we heard that our community needed more night events. And so here are several coming up. One for tomorrow. Actually, two of these will be tomorrow, from one of them 5 to 9 at the 200 East Santa Clara Street. There will be a night clinic there, and you'll be able to get your vaccine there in City Hall. And then you'll have another one in South County at the same time, or 5:30 to 7:30. Go by, get your vaccine if Morgan Hill is closest to you. And then we'll have another one on September 17th from 5 to 9. And that's at the Holy Families, the festival. There will be the night clinic at 4848 Pearl Avenue. And so you can also get these flyers on our Facebooks. You're able to look there. And if you were unable to take the address down and not sure where they're at, you're able to go back there and get that information. And also send it to your friends and family. Next slide, please. And then these are other drop-in vaccine sites throughout the county. Again, all of these are on our dashboard, and these have all of the different areas that you are able to go to and get the vaccine. And you can go back to our dashboard and get that information, or go to our website for the vaccines. Next slide, please. And then, as we mentioned, or the doctor mentioned, we're in flu season. So the county is also providing flu shots, and they will be free. There will be some tonight. As you can tell, we had one yesterday and then Monday. But we do have an event tonight, or right now, from 2:30 to 7. And it'll be there at the county fairgrounds expo hall. The entrance is through gate D. And you are able to go there and get your flu vaccine tonight if you would like. If you have, no other way, or if this time just worked for you. And we want to make sure that we also make the flu vaccine available for our community. And then also, I think I read in one of the comments in between the conversations, trying to keep up with all those. Just a reminder, right, that we do get to eat the right foods, that we do get to treat our bodies well, because, as we mentioned, the flu season is here. So we get to be as healthy as we can so that we are able to withhold any of these different, the COVID virus, the flu viruses, all these things that come around, that although, the vaccine protects us, if we have a very well taken care of immune system, then we can be almost 100% immune. So let's just take care of our bodies, eat well, exercise, sleep. We all know the areas that we get to be a little better in, and let's just do our best to do that and take care of ourselves. Because when we take care of ourselves, we take care of our community. Next slide, please. And then these are the different resources that we have. Again, these different resources are on our websites. But the numbers, to remember, I mean, on here you'll find resources around schools, around food, all those things that we all need in order to continue to be healthy all around. So you can find them there. But if next slide, please. If you remember any numbers, remember 211. That's easy. It's somebody will answer the phone call 24 hours a day, and whatever it is that your need is, maybe it's not around the vaccines or testing. It might be another need for our county. Then they can direct you to the right place. But we also have like I said, sccfreetest.org to talk about or find out where the testing places are, and then the vaccine sites as well. Go to our web pages. You're here on our Facebook. Our YouTubes will continue to provide the information needed in order to continue to be healthy and get through this as fast as possible. And again, as we take care of ourselves, we take care of one another, and we'll be able to get through this hopefully in the near future. And so now I'm going to bring back Dr. Gerardo Solorio-Cortes. Thank you so much to everybody for being patient. I know we changed the format around a little bit, but I'm going to go ahead and open it up, Doctor, to the questions. So I'm just going to go down and read through the questions, if you can help us answer them. Okay, so the first one is from Pete Adams. I think that's the first question in regards to what you were talking about, and I'll go up and see if maybe I missed anything. We also have staff supporting. Is the county looking to implement proof of vaccination like other counties to enter businesses? Do you know anything about that?
I'm not aware of. I mean, I do understand the theme is mandates in workplace. Now talking about buildings, restaurants, and such. I just got a alert from the LA Times, and I believe in LA County they're mentioning they might require proof of vaccination for even hotels or restaurants. So it's. I mean, I think the science is saying that one of our best tools right now to fight COVID is the actual vaccine, and I think going back to workplaces, a lot of the reason why many workplaces want to do this is or doing it and mandate it is to protect first off the patient, but also the person, but also the workplace individuals, and now we're talking about customers or patrons. So but in terms of the actual county-wide, is that going to be a mandate or law? I am unaware. I don't know the answer to that question.
Thank you. Yeah, no, I agree, and I hope that we don't have to get to that point, right? Because we're all doing it to take care of ourselves. But I know for example, there are employee agencies. There are different agencies within our county who are mandating their employees to get it. And so it might be from start from there,
Yeah.
but hopefully we don't need to get there because we all get it, to want to have a better health for ourselves and our community. Okay, so we have Angela Bedell. She's asking, what threshold does the county need to hit in order to remove the indoor mask mandate? Which individuals make this decision?
Excellent question. Going back when we started these forums and when pandemics started and we started looking at numbers in terms of the herd immunity, what percentage of people need to show immunity from natural infection or immunizations. And I still recall with, for example, Dr. Fauci and other health officials talking about the 70%, 80% herd immunity. As you can see with the county, we are reaching that or surpassed that in certain communities. And the question is it 80? Is it now are we looking at 90%, even 95%? That's still a up in the discussion point, and a lot of health officials, scientists, infectious diseases doctors, vaccines specialists who are looking at that number. So that's going to be a number to look at. How much of our community is has been immunized with the vaccine, or having the natural infection immunity. And it's a pretty much, like I said, month by month they'll let us know. And also, let me go back, the positivity rate and the amount of cases in the community. So I think taking that into consideration, how much active disease is in that population, and how much of the population is immunized, gather all that data, that will determine, okay, is it safe now to layer this protection off, from the pandemic. So I think those variables are going to help us figure out when we could start peeling off these protections that we got right now.
Thank you. And then Angela also asks, some schools don't allow for mask breaks. Can the doctor comment on the importance of this? And before you comment, doctor, I just want to make it clear that when I mention that, it's when they're drinking water, it's when they're eating. So absolutely, if schools aren't allowing that, then, we need to know. But I meant, to take the break to drink their water and to eat, which is obviously they need to have their masks off. But Angela is wondering if you can comment on that.
Yeah, I definitely agree. Putting myself in a child's, position, of course, number one is protection with the mask, and then second of all, now in terms of like comfort, are they able to tolerate it? Do they need a break, a few seconds, a few minutes to decompress, take off the mask, and relax for a few seconds, minutes? Yeah, I think that's totally legit. And I think working with the school district, that's where that discussion needs to be had, definitely.
Thank you, doctor. And let's see, the next question we have here. I'm trying to see if there's a question there. I know there's a comment around crossing guards. I don't see a question, but basically, if we can advise for crossing guards to wear their masks. Absolutely, not just crossing guards, but anybody, right? I see people all the time, just, with half of it, just covering the mouth. So we all, whether you're a crossing guard, whatever it is that you're doing, definitely important to wear your mask, especially when you're indoors, right? And I'm not, saying crossing guards definitely probably, I'm assuming they have to wear it even though they're outdoors, because the mandate right now is for the indoors. But I understand that they're, dealing with people. But we should all wear it, not just the crossing guards, everybody. And so, as I mentioned, the correct way to wear it, and just, checking ourselves. And if we see somebody, maybe they just don't realize, maybe they do think they're being covered, and you can gently remind them. I think the problem comes when we want to disrespect, or my way is the best way and you got to do this. But if we come with a compassionate, empathetic attitude, with respect, and then remind each other, I think that's what it's about, taking care of ourselves and taking care of one another. And then we have Angela again, and she's asking if vaccinated can still carry the spread and spread the virus, why would vaccine passports be implemented anywhere?
So I'll answer the first part, where the questions, if vaccinated still carry. So that is true. I mean, studies have looked at people being vaccinated and having, it being asymptomatic, meaning having no symptoms, but then getting tested and their PCR test, nasal test, turns out positive, and they were vaccinated. So that definitely, it's true. It could happen. And then the second part, why would vaccine passports be implemented anywhere? Going back to the data again, I mean, when we know that hospitalizations and deaths are less with vaccinated versus the unvaccinated. So pretty much what I'm saying is that what you'll see in the hospital, percentage-wise, 80s, 90s, and above percentages will be the unvaccinated, and also the deaths. I think we're looking at that. A reason why vaccines and the passports would be beneficial to the community as a whole. That ultimately, the vaccine is effective at preventing severe disease. So there is still a purpose that shows what vaccine versus that, what vaccinated versus unvaccinated means. And then as we move forward, with the pandemic, we'll know in terms of the protection of disease as we move forward as well. Again, we're talking about the boosters as well. So there's still a point for knowing like who's vaccinated versus unvaccinated, because it makes a difference on where we have seen active disease, and more specifically severe and deaths from COVID. And again, going back to knowing who's vaccinated and who's not vaccinated.
Thank you, doctor. And I'm going to remind the community, if you have any final questions for the doctor before we close up here, please put them in. And if I don't see any other questions for you, doctor, then do you have any closing comments to close us off today? Reminders?
No, yes, I think at the beginning I pretty much mentioned all the key points that I wanted to mention. In my clinic, and also just systems wise, we still have we know the data that there's thousands, millions of individuals across the state in California, United States, who are still not vaccinated. So we're here, to help. If individuals have any questions, please reach out, and let's get to the. Like I mentioned before, the herd immunity percentage. Since we're up in the 80s, we're looking at 90s, 95%. So let's keep on going. And thank you so much today for tuning in. Thank you.
Thank you, Dr. Solorio-Cortes. And yes, just, again, a reminder to take care of ourselves, mind, body, and spirit. That season is changing. And so not just ourselves, but our families, our children, each other. And we will be here in 2 weeks again. Feel free to, let us know what topic you would like to discuss, in relation, obviously, to COVID vaccines. We do have Dr. Solorio-Cortes here every other community forum, which is every month. And so thank you so much, Doctor, for your time and coming in to inform our community and ensuring that we have the availability of the space and time to have a direct conversation with you and ask any questions that we might have. I know you've helped several community members already, so thank you for that. So looking forward to the next one in a month, Doctor. And we will come back again in 2 weeks with another topic. But also I want to let you all know that the Binational Health Week is coming up in October. So during that month, we will actually have different guests on Fridays focusing around the Binational Health Week resources and community events coming up. So it's just things to look forward to. I think the more we hear about and the more resources we have, the better. Then we have choices. And we have different leaders and experts to be able to answer any one of our questions. So until then, we'll see you again. Take care and have a great 2 weeks. Thank you, Doctor, for joining us.
Bye-bye.
Bye.